What do you think are the contemporary issues affecting educational psychology?
Well, I suppose ultimately the most important ones are supporting the government in raising standards for children's education, and that's for all children regardless of their needs, abilities or potentially disabilities. But it's also about promoting children's well-being. And so the role of an educational psychologist is to work in partnership with teachers and parents and other professionals to identify children's needs and to make sure that we put in place the right kind of provision to enable each child to reach their optimal levels of functioning.
As an applied educational psychologist, you must have easier access to children with a range of needs for research purposes. Which groups are you currently researching?
Well, basically, during our 3-year doctorate, our students all have to undertake a piece of research as part of their studies, and our ease of access to a whole range of children with special needs does mean that we're really able to engage effectively with low incident special needs and to help improve the levels of understanding within education and psychology about how those sorts of children think and learn. My own personal research areas focus mainly on children in public care. So those are children who are looked after by local authorities, and historically these children actually have quite poor life outcomes, and what we've been showing is that with the right kind of emotional support and really good effective teaching, these children can achieve at the same rate and same level as their peer group. Well, I'm also currently doing some research with children who have autistic spectrum condition and really looking at their social and emotional development, and particularly focusing on issues around their friendship development, their sense of themselves, how they cope with transitions between primary and secondary school, and really looking at the kind of support that needs to be in place within schools to help these children cope better in an inclusive learning environment. Similarly, I'm interested in children who are at the more severe end of the disability spectrum, so children who have profound, multiple, complex learning needs. These children who potentially may not be able to speak or to actually represent their own views and feelings, and thinking about how do we make judgments when such children are in situations where they may have been exposed to abuse or neglect, so making sense of their behaviour, and also looking at self-injurious behaviour within that population. Increasingly, we're beginning to recognise that that sort of behaviour may be more of a reflection of underlying unmet medical needs than necessarily a behavioural problem per se.
We hear lots of concern about children in care and their life outcomes. Your research seems to be making a difference. So can you tell us a bit more about that?
That's one of the great privileges, really, of being an applied psychologist myself, is the access to difficult to reach populations of children. And within the local authority where I practice with my students, we've been able to work very intensively with the looked after children population there, and we've actually put together a literacy intervention. What we wanted to do was to see if we could work in a proactive and preventative way, so getting to the children and allowing them to engage more effectively in education early on. One piece of research has consistently highlighted that if these children are literate, they can engage educationally and have much better life outcomes. So we've put together a reading intervention for all Key Stage 1 and Key Stage 2 children within one London local authority. And we've actually been running this programme now for a number of years, and it has pretty much eradicated illiteracy with this group, but it's also led to a significant reduction in the number of children who are excluded from school. So we're seeing that if you put an investment in early on, you can actually eradicate some of those negative social outcomes for these children. And I'm keeping my fingers crossed that we'll see quite a few of them entering to the university system ultimately.
You're interested in the social development of children with autism. Can you say a little bit more about that research?
Yes, I think that increasingly there's a higher level of identification of children with autistic spectrum condition within our schools, and many schools struggle to respond to the needs of these children. And it seems to me that we have a very limited understanding of how much social awareness these young people have and the sorts of support that they might need to build friendships and to become integral parts of the classroom. The government has encouraged much more inclusion for children who are high-functioning autistic spectrum children. And what we've uncovered is that whilst there might be a high level of interest in individual education plans focusing on their learning needs, historically their social and emotional needs have been much neglected. And this has led to many of these children having quite serious anxiety states and emotional and behavioural difficulties in the school context. So again, in partnership with a number of our students, we've been involved in studies trying to understand the nature of friendships that develop between children with an autistic condition and their mainstream peers. And what we're identifying is that they almost have a very different conceptualisation of friendship to typically developing peers. We make assumptions that all children will arrive with the basic foundation skills to build friendships. This population really do need some support in building friendships, but we have to be very careful not to impose what we describe as a neurotypical worldview of friendships on young people who have a different conceptualization. So they're much more likely to see friendships as functional. It's somebody to play with, it's somebody to help me out when I'm having difficulties, as opposed to a sort of real strong emotional connection. So part of the work that we're doing is helping teachers to think about how to enable these children to build the prerequisite skills to be, socially and emotionally connected with their peer group at schools. And again, we're thinking about the implications for parenting the children.
You recently worked with Raghi Omar, looking at the issues of race and intelligence. This is an area of real controversy. So what were the conclusions of that program?
Well, as you'd be aware, the whole issue about race and intelligence is fraught and highly emotional and rightly very controversial. Historically, I think there's very good foundations to really critique that finding that there may be differences between different races and their levels of intelligence, not least because the sorts of tools and instruments that are used to measure intelligence are a Western creation, so they're terribly culturally biased. And I think most contemporary psychologists would say that they're based on century-old theories and models of intelligence. So there's a kind of fundamental flaw with the tools that are being used to measure those abilities. And as I say, they're culturally insensitive. What the documentary with Raghi Omar did was really look at different societies and different cultures and to look at the evidence base. And whilst there's some sort of neurobiological evidence of differences, not just between races, but actually between genders, all of which are very controversial and very difficult to pin down and quantify. But what they did find was by looking at, in America at Stanford University, they decided that they would use nothing more than standardized assessment scores to decide who came to study there. And it was identified that the vast majority of students at Stanford were from the Pacific Rim countries. And in unravelling the factors that led to this population seemingly having much higher levels of intelligence was a real notion of the cultural differences. And that within those cultures, academic learning is very, very highly praised and highly valued. And that those students, when people watch them on campus, outside of their sort of timetabled study time, they tend to form their own little study groups. And the whole notion of the value of learning in academia is much higher in that culture than in others. And I think that ultimately the conclusion was that there probably are minimal differences between genders and races. The factors that are really significant are culture.
That was great. Thank you.
Thank you.
Very much, Vivian, for taking time to answer the question.
And thank you, Fernanda, very much for asking such interesting questions.
Thanks.
Thank you.